If I live in Myanmar, I will die. In MedPark, yes, I live. My name is Kyaw Thiha. I'm from Myanmar and my age is 32 years old right now. The leaking problem with my lungs is actually I know about at 32 years old. Since before that, I never known about that and I never been experienced about that. All of my doctor from the hospital, they're the specialists and the professor. They already, they can't because they don't have the efficiency of the facility and everything about the lung surgery. So I searched on the Google and I searched for the MedPark Hospital. So I decided here because I don't want to take any more time because I'm have a difficult situation about that because I have to go to the emergency room and I have to penetrate the lungs tube is 8 or I think 8 or 9 inches, yes, inside of my lungs.
So at first, he came to the hospital in Burma with the symptom of chest tightness. Physical examination was done back then, and then the lung sound is decreasing quite a lot. The condition called pneumothorax, which is a lot of air inside the lung is leaking and then it's compressed the lung and the heart. These conditions normally happens to those young patients, especially when you saw a patient is very thin and very tall, they're likely to happen. Causing because of the lung that have bleps or bubbles in the tops of these regions. When it's popped, the air is leaking out and then it's compressed the lungs and the heart. The dangerous of this symptom is when it's compressed all the lungs and all the heart, it makes the heart twist. When the heart is twisting, it's called a tension pneumothorax. It means that the aortas cannot pump the blood out and it might causing cardiac arrest. His symptom in Burma is nearly causing the tension pneumothorax. So patients seek out for us for help and he fly over here with the chest tube.
So before coming to MedPark, what were your expectations?
Expectation is to live because one of my lung it's inflammation in the situation. So
when he arrived at our hospital, he had the chest tube and the bottles of drainage is not very well established. And then the air is continuous leaking. It's like when you have the fish tank at home and then the bubbles keep coming out from the airing machine from the fish tanks. It's just like that. It just keep coming out and coming out. And his lung don't even like fully expand. So that's why we need quite urgent surgeries to prevent first tension pneumothorax and the second is to prevent the infections that's causing from the subcutaneous emphysemas. So in order to do the surgeries, I use the minimally invasive approach, which is called VATS or video assisted thoracoscopic surgeries. I create the incisions around 3 to 4 centimeters and the size of the bodies and then I insert the camera in. I saw and inspects all the lungs, which in his conditions, there are a lot of bleps here in the top of the lung, quite a lot. We excise this part of the lungs and then we seal out the top part, which is kind of like cut out the place that causing the air leakage. And then we seal out the raw surface there. And then after that, I place one chest tube. So basically, patient gonna have 2 incisions. First is 3 centimeters, just for the taking the lung sound, and other is I think it's less than 1 centimeter for the drain to come out. After surgery, the lung is expand. I think around 3 to 4 days after the air stopped leaking, we removed the chest tube and he was very fine and able to fly home after like 4 weeks until everything is healing. Because every lung surgery, we not recommend that the patient to fly or go into like place with high altitude in the first 4 to 6 weeks. I'm very happy with the result of the surgeries because after surgery, his lung is expand and keep expanding and fully expand in just like after surgery right away.
after surgery I feel very good because before that I don't have a chance, just like the 50-50 situation. But I choose the MedPark to take my surgery because I believe it will be successful it will be success. And I also check about the doctor supervisor. He was very good. First of all, thank you, my doctor supervisor. Because who is the one who saving my life? That's why I'm living here and I'm sitting here and taking the interview right now. Because first of all, when I first met with him, he's very friendly. So every other who will be have their situation just like me don't need to be worried, because the supervisor will be take care of everything, because he's very good and very excellent. Yes, excellent about his job.
MedPark Hospital, redefining healthcare.